Clindamycin 300 milligrams capsules are a prescription antibiotic used to treat a range of bacterial infections. As a member of the lincosamide class, clindamycin works by binding to the 50S ribosomal subunit of bacteria, thereby disrupting protein synthesis and halting the growth and reproduction of harmful bacteria. This medication is commonly prescribed for skin and soft tissue infections, respiratory tract infections such as pneumonia, bone and joint infections, dental infections, pelvic inflammatory disease, and certain cases of MRSA when the bacteria are susceptible. The usual adult dose ranges from 150 to 450 milligrams every 6 hours, with 300 milligrams often taken 3 to 4 times daily. To reduce the risk of esophageal irritation, it's important to take clindamycin with a full glass of water. Common side effects include nausea, vomiting, diarrhea, and a metallic taste. Serious reactions, although rare, require immediate